Choririk ngan choririk ilaj mor echo non-private ak non-government image pelong ngan choririk ro ilo pelakan Marshall Island. Kemich promote ej mor manet norin chetak ilo am command training, outreach, building self-esteem, self-identity, im kilen charbal ipendro. Katabaro am im ejengan wat melan chuan armi aga wat mulin chuan armi ngan nor ewamma. Choririk ngan choririk ilo ejmor karmerong ejak ilo chontojin radam yon pugi raldongol chilchinoyo. Chen late talin keju chonche. Dagar chuan yan rago ilo family planning im adolescent el development ilo rayo and chicken ejmor alap ilo ailing kainan. Im ilo chontojin radam yon pugi raldongol chilchinoyo. Ubiji nagar marong chanolak eno chuan chadar NGO chen Ministry of Health. Sibarabar im kattabar ko an ubiji nan choririk ngan choririk ilo ejmor raj chuan ngan kadangan choririk ro ilo am common youth leadership im health training seminar ilo alup jamar ro ngan kadangan choririk drama skit al im ICL material development outreach program and promotion. Chilu ngan common outreach ilo chugol im choririk aga chugujugun pergo emen ngan provide adolescent reproductive health clinic im charabalgo ikichen counseling. Ekkarangan observation ag ekkada kain rekwala ke problem kainan choririk rekwalok ag rechinojen imogo ag janro uwan pamaliyo. Megarta support go an programin e won malawot ngan tabar chibarabar im katabar go ngan chibang kalak capacity im awareness ilo chugujugun pergo. Wawenin ena chibang chori rigro ilo chugujugun pergo.
AIDS is now a pandemic. In 2007, UNAIDS estimated 33.2 million people worldwide had AIDS that year. AIDS killed 2.1 million people in the course of that year, including 330,000 children. And 76% of those deaths occurred in sub-Saharan Africa. According to UNAIDS 2009 report, some 60 million people have been infected, with some 25 million deaths and 14 million orphaned children in Southern Africa alone since the epidemic began.
So Youth to Youth, we are an organization in the Marshall Islands that works for a variety of things, including reproductive health and substance abuse prevention and treatment. And for reproductive health, a big focus of ours is trying to prevent and treat STIs, including HIV/AIDS and other STIs. So as part of that, we distribute contraceptives, including male and female condoms, here at our center, and promote the use of contraceptives by all of the young people in the Marshall Islands. And a particular focus of ours is working with young female sex workers here, both in Majuro and on Ibai. This is something that is a problem in the Marshall Islands, especially given all of the shipping that's coming in from other countries and some of the nightclubs and bars that we have. So our goal is to work with these young women and also with the young men who are potential customers in order to educate them about options that they have, options for using contraceptives, options for other types of employment and other ways of earning money, and also to educate them about some of the risks that are involved with risky sexual behavior and having multiple partners and not using protection. So we teach them about HIV and AIDS, about how it's spread, about symptoms and treatment for it. We teach them about other sexually transmitted infections, including syphilis, gonorrhea, chlamydia, HPV, and we teach them about ways to prevent those, ways to treat those, and ways that they can help make themselves safer and make safer choices. So as part of that, we have a clinic that's open every Monday and Friday evening, where we offer testing and treatment services for STIs and HIV/AIDS, and we also distribute free condoms, both male and female. And really, condoms are the only safe way for having sex, so we really try to promote use of condoms, especially if anyone's going to be having multiple sexual partners or engaging in other risky sexual behavior. The only real way to be 100% sure about preventing HIV/AIDS and other STIs is abstinence, not having sex, but we realize that for a lot of young people that's just not a realistic thing to ask of them. So we try to make it available so they have different choices. So if they do choose to be sexually active, that they're able to use condoms and to protect themselves and to protect their partners. So really that's our goal, is to stop the spread of STIs and HIV/AIDS, and when there are cases, to treat them, to refer people to the hospital, to refer people for counseling, and try to educate people about their options, about risks that they're taking, and about all of the different diseases that are present here in the Marshall Islands.
Kami di pun cara balik pen, armi jaro mir mula ber kau, rong la ber narong kau tatangan, pakai nangan bini nerot. Kami cara balik pen, yutu ro mir jajan pun ni ara rai, seks ko ro ara. Kami cara balik pen, ro mir cara balik do tema ko, itu takan jalan malam. Kami parano, dia tu lihat takin pakai wai, rabai mi tiba. Kantam kami dia tu lihat tangan, kajojo par, dia tu lihat tangan, rektar no, apa ko. Ya itu jenuh orang anak mencoba mi ibiroran cari beruran darong pergi mi dengan jenis mi roburi mi recep pernah cerita yang recep panah teman kali ni mandi tu yuk beriba roburi mi jangan itu mi loy kaji dia wire aku perata wire romak tayar ya wajah lagu tongan ubigi ya wajah cerita cikul kami kami di kampung itu ini dulu mana lukun anjor lukun cara wajib pen seks kokorok kami lukun foto yang ada kami ini dukun cerita piara kata gini yang ada ni Jerome de gamu HIV email gini nem kami kiwai lala gairangan kelai gam imrot tay jim dale nang kai nangan ni ngayat ini mereturi do bedomi aga jadi anang milin kami referral lagi ramando emoji
menoji karong alam ji kitchen nang mi HIV kuala melele gome pen marong kaji mai pen melele kali HIV wayo ina men karu jalak melele ini jadi karu ji radio beba ko brojo ro TV ini jadian wayo mo inform kami tabar army ji na otarala army ji ro mere chen marong melele kan nang mi ni HIV kami situ tak men cibu autori jangan kuala melele ni HIV dengan aju lo kan Putola kung calatain, pagong melalaga.
Sibang jauh gitu kan. Kena ni pir. Tukajur. Distribute kan tamu pen. Panir kan kemudian tanah kan bijin.
Jual cara boleh nak jual ini keman autori jangan pemberai nangan ini.
Kari kalau kagak pemberai nangan ini istilah yang pernah HIV itu nasional. Di nomor elangnya pembijin aja merang collaborative pen MOH atau pemberai not MOH yang pernah rago cetan youth yang kininar yola bila ini kinar ini memang cuan. Baik ini merang pemberai kalau tak kari kalau nangan istilah yang HIV nasional. Jangan.
Yo.
Ya, enan taruh berat.
Main Roland tuh sih.
Roland tuh kala kita ruya gila.
Yo rongoro
wecit. Ya ngaji lalu tuh nih, inorong kaji tuh nih kaji tuh kicen ini saya sih. Oke, ngai Yorgam melalui kicen nang ni jenis saya sih. Atau yorgam pecel ya kan.
Ay nang ni ni jeno. Jadi nang ni yo ngai. Jalo guno air menu matang lagi cepet itu.
Kona baik nangan video jalo guno kona baka uat kan.
Ay.
Aku kucune ome yakan seksual aktif. Ada ome jadi peripen detik jabrutin.
Ay.
Mau yura terene me kuc peripen dari kuc kejar balkein pemrai ko eno kan kamu.
Iya gue ngale. Jauh punyam kejar wale jalo. Jingo orang tolong kau kita langan pokok dan cenginya ini jalan jadi sama malu.
Kau baik jalan, ini nama je kejar panen jalan bilo kami itu di antara nani itu yo. Oke, aku kan aja nomor tak, mana? Jawab. Bet, ijat mau riding.
Aman.
Iya, anak kunci barang lo.
Jangan tangan tahun.
Tahun itu, emang kau katar buat.
Katar pa ya coba yang topat.
Ini lo terain me, kau katar buat cuma kau kain kajin ucit kacit.
Aman.
Itu kan ini kan kami community project itu jen dan ini pen cari itu kan. Para itu belum ya kayak pen. Kau ini aroma teri itu terain me itu biar kita. Oke, orang kampus cala ya kalau melalui kitchen ini saya biar ini.
Itu dukun melalui kitchen ini jadi.
Macam dukun melalui. Bangal dukun lewat ciri melalui kitchen ini saya biar ini. Saya biar ecuan. Agar saya biar ini ecuan yang menjadi kan dukau. Cala menurut. Yang ibirodo anajere cenar mi judo tereni mi recep kejar balkantam aga ken pokrayam mat kuchuno me ekan peripelri ko ye ai ema judo tereni mi kuch peripelri ko ye kejar balkantam
punya kejar ketang kan punya teraje dari gini gua dari gini
kon bae kuch kejar bale kan ke laba lege na me ko e molangan ko em कोई गना कागे में जो कहीं नांग में जीने के बिरोड़ा ना जेरे इलो ट्रेन में लिया ना ले ना रो जरा रिपेरी पेंडोन इलो ट्रेन रो चप्पे रो काम दम के jadi kan alari kan merong lelak naang mi jenis saya yang kelewa yang pertama na merong poprai gi unda gi pe me kejar kan jit
Manumal.
ako ko kana jono mol dada
Ay,
cara mo lo try manam takol
mal.
Hello.
good afternoon I am from Youth to Youth and my name is Alvin Mubin and I'm here to ask you some of the questions about the project we do today it's for HIV and AIDS project so can you introduce yourself
Yeah, I'm Eric Hahn. I'm a teacher at Lara High School.
for what grade
12th and 11th. 11th and 12th, mostly.
how long have you been here
2 years.
Okay, my question for you is, are you aware about any information about HIV and AIDS?
I think I'm pretty well informed.
So
I'm
can
aware.
you tell me what HIV and AIDS means?
So it's an autoimmune disease, HIV, and then first it's HIV. If it festers for long enough, then it turns into AIDS, contracted through blood contact or sexual activity,
That's great.
and it basically makes you sick. Well, it doesn't necessarily make you sick, but then if something else makes you sick, then you have no immune system, so then it's really, really bad.
Well, that's great. So my another question is, are you sexual reactive?
Yes.
So while you sex with some women or some girl or with your girlfriend, do you use the condom?
I always do.
Okay, thank you, brother, for your information.
Thank you.
Have a nice day.
You too.
The UT and Health's condom distribution is mainly spread out to public areas. Gasoline stations, nightclubs, bars, restaurants, and shipping ports. The main idea is to provide an easier access to condoms for those people who are sexually active. It is within the UT and Health's belief that bringing condoms to such places like these is a much easier and helpful way to prevent HIV/AIDS.
It's Travis. Let's take a second and reflect on what we can do. To be smart and play a part in something beautiful. Embrace life, appreciate the fact you're even breathing. Cause we in the crosshairs and it's open season. If each one teaches one, we got a good start. You're not a square cause you care and have a good heart. We gotta speak soft and listen harder. It's right in front of our face, but we don't even bother. Think about it, think about it. Be about it, don't be afraid to speak about it. Don't cry about it, even though they lie about it. Set a fire, inspire, don't turn the other cheek about it.
Can't change the world overnight, but we can start by saving a life. One at a time, one at a time. So let's make history and help out those in need. One at a time, one at a time. We can change.
I feel like my generation's complaining about things we don't have. But if you think about it, we ain't got it so bad. Trust me, I know bad, and I met worse. And it'd be so sad to sit and let it get worse. It's a simple concept we need to grasp quickly before we end up wishing we did something differently. So go on and spread the word and not the virus. Come on, let's get together, try and put this all behind us. Think about it, think about it. Be about it, don't be afraid to speak about it. Don't cry about it, even though they lie about it. Set a fire, inspire, don't turn the other cheek about it.
Can't change the world overnight, but we can start by saving a life. One at a time, one at a time. So let's make history and help out those in need. One at a time, one at a time. We can change a life.
If I can change a life, then you can change a life. We can change a life, so let's just change a life.
One at a time,
Yeah.
one at a time.
If I can change a life, then you can change a life. We can change a life, so let's just change a life.
One at a time,
Come on.
one at a time. We can change your life. Can't change the world overnight, but we can start by saving a life. One at a time, one at a time.
Bring it